What's going on, guys? Welcome to the circus, and today we're going to go down that road. We're going to talk about the media coverage of this whole situation, and I'll tell you what triggered this episode, and you're looking right at it. I was actually reading an article completely unrelated to the bug, and it's something that I'll be covering in a future episode, but I look at this related article. Now, this article that I'm reading is an article about a pedophile ring who was busted. And these are the two related articles to that pedophile ring bust. They're both regarding the bug. They're certainly not regarding anything in law enforcement. It's very strange. And then you look, America's first coronavirus death was a healthy 57-year-old woman. Why would you be pushing that? It really reminds me of the AIDS has no face thing from back when HIV and AIDS was ravaging America. They would constantly say that there's no face of AIDS, that everybody gets it at all the same rate, which is completely asinine. And it's this kind of same thinking that has the media highlighting one single fatality because it doesn't fit into the statistical analysis. Okay, so right now, people say that have any kind of inkling if they've been paying attention, that the vast majority of deaths from the bug are people well into their late years. In many cases, past the average life expectancy age for a male in the United States. And they have at least 2 comorbidities. This is the vast majority of people who die from the bug. So, instead of covering a news story that would convey that information, the reality of the world, they choose to create this piece that highlights an unfortunate circumstance where somebody outside of the average age group and that was healthy and didn't have any comorbidities did die. And throughout this entire thing, nobody has ever said that this virus is not going to take young life. And honestly, I thought it would take a lot more than it has. But to do this, it's so insidious because it's fear. They're trying to instill fear. And how do we know? Well, let's just go look at the CDC website about what's going on. Okay, so here we're on the CDC website, and we're looking at data as of April 24th, 2020, of the processed deaths that they've had on the CDC website. And if you look here, we have a total population of 327,167,434, with a total of COVID deaths of 24,555, and that's going to go up. It's already being reported higher in the media, but that's because if you look on this chart, it separates COVID-19 deaths from deaths with pneumonia and COVID. And there's a big problem with that because the doctors are starting to speak out about how they've been told to change how they report COVID-19 sicknesses.
We have had people of all age groups die. I just want to be clear in terms of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that if even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
Total death rate. It's worth remembering again that the ONS rates are people who've got COVID on their death certificate. It doesn't necessarily mean they were infected because many of them haven't been tested, so we just need to understand the difference.
Well, last Friday I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after, and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
Even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death.
People who've got COVID on their death certificate, it doesn't necessarily mean they were infected because many of them haven't been tested.
Everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of birth.
Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000. 3 times.
But let's look at the population, because remember, our article wanted us to be afraid if we were a healthy 57-year-old. So that person, she would fall in between 55 to 64. In that category, 3,124 people out of 42,272,636 people passed away. In the same calendar year, deaths from all causes out of that group, there were 82,866. But what I really want to draw your attention to at this data model, the percentages of deaths get so much higher, exponentially higher as you get older. And the thing that is so crazy about the last category of 85 years and over, they have the most deaths out of any category, and yet that is only out of 6,544,503 people. So having 7,300 people pass away from COVID-19 out of 6.5 million is the worst it's gotten in America. This is the extreme high end of the spectrum. They have us in fear over these death counts, and just to show the insanity of this, deaths from regular pneumonia are placed right next to it, and you can see it kills children, and then you can see the numbers jump up exponentially again, except they're in the tens of thousands in these older categories. So in the same time period that 7,268 people have died from COVID-19, in the 85-year and older category, 17,995 people in that age category have died from regular pneumonia. So they have a very high mortality rate for elderly people, but essentially only a high mortality rate for elderly people. In the 15 to 24, in the 5 to 14, 15 to 24, and 25 to 34, and 35 to 44 categories, we have 40 million or so people. So it's relatively the same amount of people, and yet we have extremely low numbers of mortality. So the CDC charts give it away that it is an elderly disease. This is the population that needs to be targeted. And the way the media purports it is that it's elderly and people with comorbidities or people with pre-existing conditions that could aggravate it. But the reality is that it's not young people that have pre-existing conditions or comorbidities that they're really worried about. Or if it is, they shouldn't be, because the data shows that it's elderly people with comorbidities. So it's not we're worried about elderly people and people with comorbidities. No, we're worried about elderly people with comorbidities. And the proof is in the statistics. And remember, along with all this age information, there's also plenty of information on comorbidities. For instance, we went over the study out of Italy that showed 0.8% of those people who died from coronavirus in Italy were actually healthy. The rest of them all had a comorbid disorder. 48.5%, almost half, had 3 or more comorbid disorders. And this is now backed up by a study out of New York City. New York State is reporting the exact same thing. In New York State, just over 86% of reported COVID-19 deaths involved at least one comorbidity. And this isn't a surprise because these people are elderly for the most part. When you're that age, you're going to have a comorbidity of some sort. It's highly likely. So we can show you the CDC information about the ages that are involved in serious outcomes and death. We can show you the fact that the vast majority of those elderly people have 2 or more comorbid disorders already. Or we can tell you about the first lady to die in America who was 57 and healthy. I'm putting up quotes. There's a reason why they want to tell you that story and not the real facts behind the disease. And the more information that comes out, the worse it gets for them. They don't want you to see the CDC data. They don't want you to know the reality behind the infection rate. They don't want you to know how many people already have had this and gotten rid of it. Because these antibody tests, they're only going to get uglier. Because they're only going to tell the story of more and more people infected with this disease, this bug, this virus. And the more people that have the antibodies, the lower the death rate will go. And it's only going to continue to go down. It is not going up from here. It is only going further down as we discover millions and millions more infected. These antibody tests have questions surrounding them, but they're being ran in LA, New York. There's a study that's being ran on Major League Baseball that gives them access to study groups out of every state. There is a lot being done with these antibody tests, and they're all coming back saying the same thing. Much more of the population is infected than the Fauci models suggested. An estimated 13.9 of New Yorkers have likely had COVID-19 according to preliminary results of coronavirus antibody testing released by Governor Cuomo on Thursday. The state randomly tested 3,000 people at grocery stores and shopping locations across 19 counties and 40 localities to see if they had the antibodies to fight the coronavirus, indicating that they had the virus and had recovered from it. With more than 19.4 million people residents, the preliminary results indicate that at least 2.7 million New Yorkers have been infected with COVID-19. 2.7 million. Now, that is a much different number than what we were looking at when Fauci was telling America that this was 10 times deadlier than the flu.
In the 2.5 months that we've had this coronavirus, as you know, we now have multiples of that. So it clearly is not as lethal, and I'll get to the lethality in a moment, but it certainly spreads better. Probably for the practical understanding of the American people, the seasonal flu that we deal with every year has a mortality of 0.1%. The stated mortality overall of this, when you look at all the data, including China, is about 3%. It first started off as 2 and now 3. I think if you count all the cases of minimally symptomatic or asymptomatic infection, that probably brings the mortality rate down to somewhere around 1%, which means it is 10 times more lethal than the seasonal flu. I think that's something that people can get their arms around and understand.
I'm trying to help the American people know where to appropriately set their gauge.
I think they set the gauge is that this is a really serious problem that we have to take seriously. I mean, people always say, well, the flu, the flu does this, the flu does that. The flu has a mortality of 0.1%.
Sure.
This has a mortality of 10 times that.
Okay.
And that's the reason why I want to emphasize we have to stay ahead of the game in preventing this.
Yeah, he did that. And that was the testimony that basically set the world on fire. And the really sick thing about that testimony is that 2 weeks later, he published an article in the New England Journal of Medicine. You're looking at it right now. Now, keep in mind it was published 2 weeks earlier, or 2 weeks later, right? And you have to write the paper, you have to gather the data, and you have to publish the paper. So even though it was published 2 weeks later, he was working on this shortly thereafter or right at the time he was making these comments to the American people. And what does this journal article that he wrote in the New England Journal of Medicine say about COVID? At the bottom of this paragraph, it says, if one assumes that the number of asymptomatic or minimally symptomatic cases is several times as high as the number of reported cases, the case fatality rate may be considerably less than 1%. This suggests that the overall clinical consequences of COVID-19 may ultimately be more akin to those of a severe seasonal influenza, which has a case fatality rate of approximately 0.1%, or a pandemic influenza similar to those in 1957 and 1968, rather than a disease similar to SARS or MERS, which have had case fatality rates of 9 to 10 and 36% respectively. Less than 2 weeks later, he publishes in the New England Journal of Medicine the exact opposite statement of what he said to Congress, what he said to the American people. He literally says, COVID-19 may ultimately be more akin to those of a severe seasonal influenza.
The flu has a mortality of 0.1%.
Sure.
This has a mortality of 10 times that.
Okay.
And that's the reason why I want to emphasize we have to stay ahead of the game in preventing this.
It's deception. And when this paper was published, you didn't see it anywhere in the mainstream corporate media. You only saw it from private individuals. Why? Because that's what they want. They don't want you knowing the truth about this kind of stuff. They want it in your head that the first death from the bug was a healthy 57-year-old woman. That's what they want you to know. Instead of telling you all the other things that I just told you. We still don't know a lot, but we do know some things. And one of those things is there's a significantly larger amount of the population that's been infected than we previously thought. And that, although it's not enough to provide herd immunity, it is way more than we thought, making the disease way less fatal than what we had originally thought. And those are good things. But there's a whole lot of bad things. And there's a whole lot of questions. You know, when I start thinking about the suicides, the overdoses, there's going to be consequences for this for decades to come. And if all of this was done based off of that one model that Fauci was using from Johns Hopkins University, the WHO and the CDC provided bunk information. If that's what happened, then somebody needs to be held accountable. And all this focus on China needs to get theirs too. But we need to start understanding that somebody literally walked into Trump's office and said, we have to close the whole thing down. You know he's not joking when he says that. That's literally what happened. And he had to obviously go with what his experts were telling him. Not good. It's not good. And I already made an episode about health tracking and restriction apps. They're using them in all countries all across the world. Here in the United States, Google has already just low-key agreed to give metadata regarding contact tracing. So say I develop the bug, Google will hand over my records so that the authorities can track down everybody that I've been in contact with. They're already doing that. If you want to go back to work, you're going to have to take the antibody test. In a year, you're probably going to have to be vaccinated if you want to work in a public job, any public service. This shit is getting real. Excuse my language. And the propaganda is real. Look at this screen. These are all separate studies that all came out at the exact same time. I've done an episode about Avid Leader Plus. It is the technology that they pioneered in order to create these 4 a.m. talking points. It's how they do this. It's the software they use. I highly recommend going back and watching that video, even though I was probably horrible in it. Regardless, it has good information. And it has that bit in it from Sinclair Media where they're all reading from the same script because they all got the same story. And I'm going to make an episode tomorrow. I've been working on it about HCQ because this VA study that the MSM leached onto is bunk. And we're not going to read any news. I've got the study. We're going to go through it and we're going to look and see why it's bunk. And then we're going to talk about why it is, if it is bunk, why is the entire mainstream media lashing out at this drug when it is helping? And we'll look at the proof that it's helping. And then we'll ask ourselves, what kind of evil person would be attacking a drug that can really help? That is safe enough to where it can be given to pregnant women.
Hydroxychloroquine in therapeutic doses is pretty safe drug. And now let me add this as well. And this, I have been getting this question a lot, that is it safe in pregnant women? So yes, hydroxychloroquine in therapeutic doses is also safe in pregnant women. Hydroxychloroquine is actually allowed to be used in pregnant women. And it is also allowed to be used in lactating women as long as the baby's weight is greater than 5 kilograms, so that they can actually use that too.
All right, guys, until tomorrow. I'll talk to you later. Like, share, sub.